only been 2 years past the establishment of this institute, yet it has accomplished great milestones. ILS's multidisciplinary approach strives to impart better understanding and perception in a rapidly advancing science-based society. Today, we have three distinguished personalities among us. I feel very honored to welcome Professor Balram Bhargava, uh, the Executive Director of Stanford India Biodesign, who will talk about frugal innovation in India. Also, I would like to welcome Shri Pankaj Bhai Patel, Chairman, Advisory Board, Institute of Life Sciences, and CMD Cadila Healthcare Limited, who is the guiding force for ILS since its inception. I would like to welcome the head of the AU family, Honorable Provost of Ahmedabad University, Shri Shailendra Mehta. We are indeed very privileged to have such eminent personalities among us to encourage us. Now, may I please request Professor Alok Dhawan to welcome the guests with a bouquet of
Wait. Please. Sir.
Knowledge removes ignorance just as light eliminates darkness. Also, knowledge is that inner wealth by which one can accomplish many things in life. We now request our dignitaries on the dais to light the lamp while my colleagues would invoke Goddess Saraswati.
कुन्देन्दु तुषारहारे धवला या सुप्रभातस्नावृता या वीणावरदण्डमण्डितधरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभुभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापमा हे शारदे मां अज्ञानता से हमें तार देना हे शारदे मां अज्ञानता से हमें तार देना तू स्वर की देवी संगीत तुझसे हर शब्द तेरा है हर गीत तुझसे तू स्वर की देवी संगीत तुझसे हर शब्द तेरा है हर गीत तुझसे हम भी तो समझे, हम भी तो जाने, शिक्षा का हमको अधिकार दे माँ, इशार दे माँ, इशार दे माँ, अज्ञानता से हमें तार दे माँ। ऋषियों ने समझी, मुनियों ने जानी, वेदों की भाषा, पुराणों की वाणी। ऋषियों ने समझी, मुनियों ने जानी, वेदों की भाषा, पुराणों की वाणी। हम हैं अकेले, हम हैं अधूरे, तेरी शरण में हमें तार दे माँ, इशार दे माँ, इशार दे माँ, अज्ञानता से हमें तार दे माँ, अज्ञानता से हमें तार दे माँ, अज्ञानता से हमें तार दे माँ।
Thank you. It's a great pleasure to have you all here. Now I would like to request our director, Professor Alok Dhawan, to formally welcome the guests.
A very good morning to all of you. It is indeed a pleasure and a proud privilege to welcome all of you today on the occasion of the second Foundation Day as well as the second ILS Oration. It's a custom to start with them, but I've always broken the custom, so I always start with the young guys. I think it's a privilege and a pleasure to welcome our students, integrated masters, our master students, PhD students, faculty, very distinguished people sitting here in front of me. And then, of course, people who are responsible for having all these people here. So I think they are the icing on the cake that we have here. It's indeed a proud privilege, as I mentioned, to welcome the very distinguished people on the dais, who are not only very eminent academicians, but also equally good innovators, people from industry. I'd first like to welcome Professor Balram Bhargav, who very kindly accepted our invitation to come and deliver the second ILS oration. He's a very eminent cardiologist, and not only that, he's of course a very eminent and a very, I would say, frugal innovator, which we'll come to know about when he talks about his work here. So I'm sure with your dynamism, you'll be igniting the young minds here. And we do hope that some of you would follow his path and come up with some new innovation. I extend a very hearty welcome to our head of the family, Dr. Pankaj Patel, who is the chairman of the advisory board of the Institute of Life Sciences, and also the CMD of Cadla Healthcare. And it's only under his dynamism that we have shaped up this institute, and we are because of his perseverance and his critical comments and suggestions that we've been able to shape up the programs of this institution. So welcome, sir. Today it is again an honor and privilege to welcome Professor Shailen Mehta, who has joined us today as the Provost at Ahmedabad University. I think he has come in at a time when we need a person who can actually take the baton forward. So the first 5 years of the relay race was run by Professor Carlo, and he set the ground for probably Shailen to take over and then take it much faster. So the dynamism can prevail in the institution, and I'm sure with your stewardship, we'll be able to take the institution and the university at much more heights. I'd also like to extend a hearty welcome to the distinguished scientists from INSTEM and CCAM, Syed from Michigan State, Pradeep, Jayesh Billare from IT Mumbai, part of the family, Shri Praful Anubai, Chairman of the Board of Management of Ahmedabad University, Professor Carro, Professor Emeritus and the former Provost, Mr. C.K. Koshi, Bhavesh Bhai, Parag. I can never forget D.K. Jain Saab. He is the one who's always been supporting us, I would say, right from the very beginning, right from the inception of this organization. So, a hearty welcome. Bhupen Bhai. When I greeted him this morning about the foundation day, bola greeting hamari taraf se. So I was just chatting with him. Without the administration or the management, things can't. Bole hum umbrella hai, to humne kaha hum log uski spokes hai. That's how the system works. So I think it's good to have such people in the management to support the organization and allow them to grow. So I think a very hearty welcome to all of you. I'll just take a few minutes to share what we've been able to achieve in the past year. So I think as the head of the fledgling institute that is ILS, it gives me immense pleasure to welcome you all on this second ILS Oration. An academic organization fostering scientific education is only as good as its research initiatives. The institute, since its inception, has focused on research in the areas of healthcare and nanobiotechnology. ILS has been fortunate in attracting excellent faculty with exceptional research track record. The institute started with an MSc program in life sciences. The next year we then started a PhD program, and this year we started an integrated MSc in life sciences. And this year we had an overwhelming response to this integrated masters, primarily due to the multidisciplinary approach and emphasis on research-based teaching and project-based learning. During this year, we had the privilege of welcoming very eminent scientists from India and abroad. We organized 2 international conferences. One was an Indo-UK symposium funded by the Royal Society and the Department of Science Technology. And some of the speakers are actually present here. The world-class infrastructure, including the centers of excellence in flow cytometry, in silico technology, and cell culture, were extensively utilized to provide hands-on training to students and researchers from academic institutions and the industry. The institute acquired a transmission electron microscope and a scanning electron microscope to initiate a center of excellence in imaging, which is supported by GEOL from Japan. The institute offered 1-year full-time research to 3 MSc students. The outcome which has been that each of them actually presented a paper of their own research work in an international conference. And one of these papers, I'm happy to inform you, has now been, in a sense, accepted with a very minor comment. So that will be the first publication coming out of an MSc student from this organization. One of our faculty, Mr. Ashutosh Kumar, who is an assistant professor, was awarded this year with the Young Scientist, INSA Young Scientist Prize, as well as the Young Investigator Award in the EU-India Science, Technology and Innovation Days in Paris 2030. Apart from that, to foster the research, we have been signing MOUs with institutions to inculcate both exchange of faculty as well as some research in the cutting edge areas. So we were fortunate to sign MOUs with the Michigan State University, National Chaotang University in Taiwan, IIT Madras, the Royal Melbourne Institute of Technology, Australia, University of Surrey in UK, Zydus Research Centre, Ahmedabad, We Life Sciences Technology Private Limited, and Vitel Science and Technology India Private Limited in Pune, and more recently, iBioanalysis Private Limited in Ahmedabad. This to facilitate research collaboration, faculty and student exchange. The institute continues its endeavor towards development of trained human resource in the field of life sciences that benefits the academic and industrial community. I would also take this opportunity to to express my gratitude to the support that I got from the industry, both in terms of research as well as in training, especially from Becton Dickinson, V Life Sciences, and Geo. They've been very forthcoming in supporting our endeavors, in training our students, in conducting training workshops here. I'd also like to thank the chairman of our advisory board for his unstinting support. Every time that I ask for his time, he's always forthcoming in supporting us. So with these few words, I welcome all of you to this exciting day today, and I hope you'll enjoy the talks that will follow. Thank you. So before we invite Balram to give his talk, may I request also Rishi Shankar to introduce the speaker.
Good morning, distinguished guests. It is indeed a pleasure and a privilege for me to stand on behalf of the Institute to introduce you to Professor Balram Bhargava. Many of us know him, but for the sake of propriety and for the students, it is a must that we know what kind of innovator we have before us today. And Professor Balram Bhargava is a professor of cardiology, eminent personality in cardiology. And besides that, he is also the executive director of the Stanford India Biodesign Center. And this is a center which is dealing with different scenarios of innovation. Professor Bhargava, not only being an outstanding cardiologist, is one of the foremost leaders in innovation, in biomedical innovation, and public health, medical education and research. He has developed indigenous platinum iridium coronary stents, which have been used at a very low cost development, which has been used and benefited thousands of patients, and at levels where it has benefited no option patients, who are waiting for cardiac transplants. So it is an innovation which is highly life-saving and giving a huge societal scenario, which is a thing to remember for us when we talk about innovations. An outstanding leader, Professor Bhargava has promoted the Stanford India Biodesign Program, a unique interdisciplinary program to foster innovation design in low-cost implants and devices. And certain representative innovations which have come out of this, essentially in last 7 years, with over 100 innovators trained who developed some 10 technologies. The major ones which are most represented are the Consure, a novel fecal catheter, a high-care limo called Afford Immobilizer for lower limb fractures, and Broom, which is a electronic feto-maternal wellness monitoring system. Foremost examples where we have problems in this country in terms of health and healthcare. Professor Bhargava is currently also developing a chest compression device for sudden cardiac death patients, which is funded by the Wellcome Trust. Based on these and other issues which he has addressed, as a researcher, innovator, and an excellent teacher, Professor Bhargava has been recognized by various academies, and he is the fellow of the Royal College of Physicians, Glasgow, the Royal College of Physicians, Edinburgh, American College of Cardiology, American Heart Association, International Academy of Cardiovascular Sciences, National Academy of Medical Sciences, and the National Academy of Sciences, Allahabad. Further, he has also been awarded in different ways, and recognition has come in different forms, with the Vasik Award for Biomedical Technology Innovation, 2004, Tata Innovation Fellowship, 2007, S.N. Bose Sanitary Award by the Indian National Science Congress, the National Academy of Sciences Platinum Jubilee Award, and the most recent one, in recognition which is recognized in this country as one of the highest civilian awards we get, is the Padma Shri, given by the Government of India in 2014. So we have this unique privilege to have him with us today to talk about frugal innovations, India's most valuable research. I now welcome Professor.
Yeah, okay. Right. Thank you, Professor Rishi, for the very kind words. Uh, I think you have um, overemphasized on a lot of things. I don't think I deserve that. Having said that, it's a pleasure to be here with the leadership of this great institute and the university. And I will try to talk a little bit about our healthcare system and then a little bit about our frugal innovation and the mindset that we have as Indians. Then we will talk a little bit about our biodesign process, which is the process how we do a need finding and some examples to start with. Now, if I were to ask any one of the students, since independence, 67 years of independence, what has India done well in? Anyone?
Standards.
Healthcare standards, okay. Anyway, that's a nice answer I got because I normally get an answer is IT. So the first answer I get is India has done well in IT. Then I probe people more and then they say, what has India done well? They say in mobile technology. Then I further probe them. Then they say, well, probably Bollywood. Then I further probe them. Then someone says, well, cricket, India has done well in cricket. Then I further probe them. Then someone comes up with the correct answer, and that is pharma. India has done phenomenally well in pharma. And then the other thing which are often missed out, and that is one is agriculture. India has done very well in agriculture. We had the Green Revolution, and at the moment we are having the second Green Revolution. And I think we remember our childhood days with Lal Bahadur Shastri talking about missing a meal, the PL 480 program, and those are the days when really India was in a government. India has done phenomenally well as far as agriculture is concerned. And the other thing which people don't talk about, and I want to emphasize on, is India has done well in medicine. Our generation has contributed to medicine that no one has to go out of this country for treatment. That has happened clearly. Having said that, we have not done well in two areas. That medicine is not available to all. And the second thing is emergency medicine. And that is the next frontier, I think, which we need to work on. Emergency medicine is another area which we really need to work on. So I'll talk to you a little bit about what is the healthcare scenario in India. And we're still not taken care of our infectious diseases, malaria, leprosy, tuberculosis, and we've been burdened by a second burden of, everyone can hear me? Yeah. The second burden of non-communicable diseases of diabetes, hypertension, coronary artery disease, and cancers. So we are in the midst of a huge double burden or a double whammy, as anyone would call it, in terms of the infectious diseases still not being taken care of, and the non-infectious or the non-communicable diseases making their presence in a huge big way and killing ruthlessly. So these are two problems which are clearly there, and there are paradoxes in the healthcare system in the country. I mean, much of the healthcare system, 80% of the population goes to the 30% of the public hospitals. These are poorly maintained. Having said that, our private hospitals have done phenomenally well. They have really contributed to healthcare, particularly for tertiary care, and India has really become the destination for medical tourism for many parts of the world, including the North Africa, Middle East, Eastern Europe, and that has happened right in the presence of these last 20 years. That has happened in a big way. There are negatives, but there are positives which have happened. Another negative, I'll talk a little bit about the negatives and then we'll come to the positives. Another negative is the number of beds per patient population per thousand is still 1.5, which is equal to sub-Saharan Africa and much lower than the world average of 3.3 beds per thousand population. Number of doctors again is increased now. It's 1.2 per thousand, but again much lower than the world average. We have been exporting nurses to the world, and therefore our problem still remains 0.9 nurse per thousand population against the world average of 3.3. So these are still problems which we really need to address in a big way. The insurance markets are much mature. The health system is there. 80% of the population is paying out of pocket for healthcare expenditure. The Universal Health Coverage Program, which the 12th plan has envisaged, which is to provide universal health care for everyone by 2017 and increase the GDP on health spending from 0.9% to 3%, is still not happening. It's still gone to 1.2, but from 2012 to 2014, it's 1.2% of the GDP, but it needs to go to about 3%, and that has still not happened. And much of the bureaucracy has stopped it. Do we have the capacity to handle that kind of funds? So that is another area which really needs to be developed. And 39 million people fall below the poverty line because of some health-related expenditure, whether it be consultation, whether it be on medical devices, whether it be on treatment, and is that okay? Yeah. So 39 million people fall below the poverty line every year because of health-related expenditure, and Indian medtech industry. I'll talk a little bit about medtech because much of our program is involved in medical technology and low-cost device innovation, because that is the next frontier. Pharma India has done well. We've really done well. Generics have really taken over in a big way. Drug discovery has also started happening in our country, which was a big vacuum, and that has also been happening. Now, much of the medical devices are really class 1 or class 2 device. Now, if I were to explain what are class 1 and class 2 and class 3 devices, class 1 devices are ordinary spectacle or glasses. Class 2 is a contact lens, which remains in the body for some time and then is taken out. And class 3 is an intraocular lens implant. So India has really been concentrating more on 65% of the manufacturing has been on class 1, class 2 bandages, simple devices. Complicated devices we've really not taken because we don't have the know-how yet, and we don't have the infrastructure yet, or the infrastructure has not yet been explored. Now, 80% of the devices are imported, and they are for the 20% of the population. 80% is still unable to afford treatment for these devices. The technology prices remains a major concern. The regulatory IP changes are good, but they are slow, and I feel, and I really reiterate at this point, too much of regulation will kill innovation. So let the innovation maybe grow a little bit before we start too much of regulation, and before we follow the US pattern or the FDA pattern of regulation. Let it innovate a little bit, let it mature, and then regulation should come in. The positive part is the Indian economy is growing. It has been doing well and is expected to go 4 to 7%. It's a decade of rapid growth, more girls in school. The economy is worth 2 trillion, 10th biggest income per person is up. The country has been stable over the last 15, 20 years. It has been stable. And it is young, big, and fast growing. Polio has been eradicated. More girls are in school. So things are really looking up. We have to be positive about it. And there is going to be, and there is a lot of money, particularly with the universal health coverage and also ancillary healthcare spending for drugs as well as devices from other ministries as well, go up to about $200 billion by 2025. So it's going to be an area where people really can work in. There is talent, but much of the talent is, we do have a lot of postgraduates, but PhDs is limited, and that is what this institute is, helping increase the high-end researchers and high-end people who are being trained for new drug discovery or new innovations in various fields. So if you compare India, we have the number of PhDs is still less than United Kingdom, when our population of India is Bombay and Delhi is equivalent to that of the whole of United Kingdom. So the number of PhDs is small, and I think that has to be bumped up and will be useful for the country. Looking at the various innovation hotspots, much of them have been concentrated around Bangalore, Hyderabad, some around Ahmedabad, and Calcutta. So this blue one is patents, and the red, the orange ones are the publications. So if you look at the various institutes that have been publishing over the several IITs, the IIT Madras, the IIT Bombay, and the IIT Delhi, we need to have INS in this list. So, okay.
Sure.
Yeah. So now let's shifting gears and let's talk about frugal innovation and more for less for more. So you're able to get more for a small amount for more population. And that is the mindset which our generation and probably the early next generation still has. But that is fast changing. And we have a limited window to utilize this frugal mindset. Because now the people are exposed too much to the internet, to mobile, and they're thinking internationally, thinking, nothing wrong with that, but that frugal mindset is disappearing. So I think we have a limited window to utilize that frugal mindset that we still have of not wasting. And I do feel that this city and this state definitely has an edge and advantage with this mindset. So Indian consumer is extremely price sensitive and willing to experiment. The National Innovation Council as the inclusive science and innovation policy is prioritizing research for more for less for more. Now, what is Jugaad innovation? Now, people have been talking positively about it or negatively about it, but it is slightly different from frugal innovation in the real sense. A number of words have been used interchangeably. People call frugal innovation, Jugaad innovation, Gandhian innovation, reverse innovation, disruptive innovation, affordable innovation. So there's lots of buzzwords that are now used for innovation, but Jugaad is our own. So we have to. It has always been there. It is a Hindi word that translates innovative fix, an improvised solution born from ingenuity and cleverness. So ingenuity and cleverness is there in our genes. We are genetically blessed, and I've said that at Stanford also. People like it or not like it, but we are genetically blessed to have clever and we have ingenuity. So that is definitely there. And if you look at the changing scenario, and this is a very interesting slide, that if you look at since 1980s, much of the innovation was imported innovation. The idea was in the West, it was developed in the West, and it was commercialized in emerging countries like ours. In 1990s, it became export-led innovation. Idea was in the West, much of the manufacturing was done in countries like ours and China and places, and then it was exported towards the West. 2000 onward, we mastered it, and end-to-end local innovation, idea from here, development in this country, commercialization in this country, and now 2010 onwards, it's kind of balanced. The ideas can be from the West, ideas can be from here, manufacturing can be in either of the two places, and it can be commercialized in both the areas, whether it be East or West. So we are in a good part of the century wherein it's a level playing field for all of you, unlike what it was for us. So Gandhian innovation is again is a deep sense of commitment to serving the underserved. It accepts the constraints that will always exist, and creatively operate within that. And it is focusing more on people, not just on shareholder wealth and profit. So that is the Gandhian innovation. and as Mahatma Gandhi has clearly said, that the earth provides enough to satisfy every man's need, but not every man's greed. And this is from this very story. Now, this is an example of spontaneous Indian innovation, which happened when the first outlet of Starbucks coffee was established in Bombay. And there was a huge queue of people to go into that cafe. And this gentleman here innovated and started selling tea to everyone who was standing in the queue. So this is a spontaneous innovation, which is and it worked. But again, it is something like jugaad, which is not long-lasting. It is very, very friable, and it's not very long-lasting. But it is ingenious and it is clever. Then this is another example of need-based innovation, and this is just outside where I live in New Delhi. People stop at this crossing and give grains to feed these birds there. And this gentleman here saw the need, that this need is existing, and people have to carry a bag of grains and then give it here to the birds. He said that, why not start selling this? He started selling these. They would be given to the birds. At the end of the day, he would probably recycle them. and that is innovation. And I think it's a frugal mindset, nothing wrong with it. And at 47 degrees centigrade, he has a little piece of jute which is red. He does not use this regular umbrella, and then the sunshine is coming from here, so it keeps him cool. So this is some sort of a need-based innovation which we have been doing in our country. So the important thing is to identify the correct need. Once we identify the correct need, we will be able to, and one can spend time to identify the needs. Don't be in a hurry to identify the need. Don't be hurried to take a need from someone else. Try to identify it yourself, be convinced about it, and then work on it. That is important. Now, this is frugal or jugaad innovation has existed in different countries. In Brazil, it was Gambiara. In Kenya, it was Jokali. In America, it was do-it-yourself. Bricolage in Australia, and System D in France. So this has existed in various countries. If you look at the World War II, there was innovation because of the cost cutting for the army for the Second World War. People had started innovating. There was the Civilian Clothing Act, CC 41, and you had to really. It was like what we used to call in our days Delhi cloth mill, or it was just available at a certain price, and people had to buy those things. More socialistic, but again, it had to be done because they had to cut down costs. Then, beetroot for lipstick, cherry juice for using as a blush, burnt match as an eyeshadow and eyeliner. This was used and DIY standardized furniture in 1942 to 1952 that existed and did very well. And after this DIY standardized furniture was the birth of IKEA. So I mean, it was in Sweden, but it basically got an idea from this DIY standardized furniture, which was there in the Second World War. So what are the characteristics of frugal innovation? They respond to limitation in resources. They are not only low cost, but outperform the alternative. So here we're not talking about jugaad, we're talking about frugal innovation, which outperform the alternative, and they can be applied on a large scale of population, and often have a explicitly social mission. Now, low cost does not mean low tech. It implies redesign, but not just defeaturing. And we have the Mediwave pacemaker being manufactured out of Bangalore. We have the Jaipur knee, which is being manufactured in collaboration with Stanford University. So the jugaad innovators are frugal and flexible. They are inclusive and intuitive. They redesign and are recombinant. They are socially sensitive, and they are talented with tenacity. So you have to accept defeat once in a while and keep on working, keep on at it. So that is an important message. We have to keep trying. So frugal innovation is low cost but high quality or high performance. It is not cheap. And if you look at the Jaipur knee, it is high performance and low cost. Compare it with the microcontroller high performance, high cost knee, or compare it to the single access, cheap and low performance prosthetic market, which are again low cost and low performance. So this is the area we really need to work on, high performance and still remaining low cost. So if you look at what are the frugal innovations that have happened worldwide since the people started recognizing it in 1975, one was the microfinance, the Grameen Bank, then the Oral Labs, which is the $5 intraocular lens implant that was developed in Madurai, again in India. At the Madurai Eye Hospital there, they set up a lab for research along with David Green, a MacArthur Fellow who spent about 4 or 5 years setting up that lab in Madurai, and they made the intraocular lens implant, which is now exported to a lot of countries in the world. It is being used in India. It is being used even at All India Institute. It's a low-cost implant, and it has been working phenomenally well. Then we have the various other examples, the Tata Nano, it's the GE machine, the ultrasound, the Tata Swatch water filter, and we have experts on water filter sitting in our audience here itself. And we have this the Nanovation, which is the dream of Ratan Tata, and that led to the development of this. It has done well in India. We do not realize it in big cities, but if you go to certain other smaller areas, it has done well. It has become the taxi transport in full of Sri Lanka. They use the Tata Nano as the taxi car there, and it is very popular there. Then this is Vodafone solar-powered phone, which has an FM radio. It has a torch, and it is solar-powered, and it can be powered by the cycle also. So this is another example of frugal innovation. Then Mansukh Bhai and the Mitti Cool fridge. This has been mentioned in literature and a lot, that this is a fridge which is made out of clay and of mud, and there is water here, and at 50-55 degrees centigrade, water evaporates and keeps these vegetables cool. And this led on to the Chotu Cool fridge from the Mitti Cool fridge. And this Chotu Cool fridge is again very inexpensive, costs less than $20, and it is rechargeable. It has only 20 parts as compared to a regular fridge, which has about 200 parts. So this is more a stripped down version of reverse innovation in the real sense. Now, if you look at the innovations that have happened in India over the last 10 years, 6 of them are in healthcare, and those 6 are the GE, the 1298 ambulance services in Bombay, the Arvind Eye Hospital and the Oral Labs that we talked about, the Swatch water filter, the Narayan Hridayalaya and their assembly line of cardiac surgery, and much of the model is what we have been doing at All India Institute, where bypass surgery costs about 50,000 rupees. They are doing bypass surgery about 80 to 90,000 rupees. And for all government employees, they've got a new business model that they will operate, and by the time the paperwork and all that happen, they can pay in 90 days. So that was the model which was innovated by them. Surgery is done immediately, free of cost, and they can pay in the next 90 days. Then you have the Jaipur prosthetics we talked about, and these are certain innovations in healthcare. The warm blanket for the child instead of the huge big infant formula. Now, I think these are the same examples. Now let's come to drugs, and I think that is another area where India has done very well, and that is the generic drugs. And what if you look at this classic example of antiretroviral therapy, triple drug therapy for HIV/AIDS, and the cost at the time on June 2000 was $10,000 treatment per year. Within 6 months, really within a year, Cipla came out with a $350 combination, and by another 5 years, the cost was $132. Now, this has been done so well by our pharmaceutical industries. The generic drugs in this country have really captured, and much of the Western population who used to talk against our generic drugs have really started marketing a lot of our generic drugs, and that has happened in these last 10 years that we have really seen. I do not know if you're aware of this Section 3D, wherein the anti-cancer drug Gleevec, Novartis was really did a case in the Supreme Court and lost to it, wherein life-saving drugs they had really modified the patent a little bit, and then increase the cost of the drug. And the Supreme Court of India struck down on it, invoking the Section 3D of the WTO or the TRIPS agreement that we did, and we won that case. And after that, the anti-cancer drug was not expensive, and we were able to get the generic drugs. And they talked about this there was a huge big flurry of articles in the scientific literature, which they said that the Indian patent law has been reinvented or re-engineered, patent law version 2.0. So Indian patents for emergency and life-saving drugs, the Supreme Court did well, and we were able to get certain drugs from the multinationals at a lower cost, and we were able to. Now, if you look at the patents in the country of origin, the red one is all the pharma, and the countries that have done well in new drug discovery and new patents are for pharma are China, USA, and for medical devices, which are the blue ones, again, Japan has done phenomenally well for medical devices. We need to have these bars in India for these various devices as well as drugs. Now, frugal innovation is more with less. We talked about it. It's more globalization. It has to be efficient. It should be able to scale, and it should have a social impact. So it should be affordable. It should be scalable. It should have a distribution network, and it should be adaptable to the local population, and people have to be price sensitive. So these are examples again of frugal. They are rugged, lightweight, simple user-centric design, the green technology, local materials for manufacturing. It has to be adapted for the local environment, and it has to be simplified, like the Tata Chemical Rice Husk water filter, and it has to be affordable for India. So there is an opportunity for frugal innovation, not only for the healthcare industry, for inventors like yourselves, academic institutes like this, and for investors and for device manufacturers. And this could be an area of drugs, it could be in medical devices, it could be in biological products, it could be in organization systems, support systems, use of information technology, bioengineered food, sanitation, drugs. So I mean, several areas where it could happen. And we captured this opportunity at All India Institute. We set up the Stanford India Biodesign at All India Institute in collaboration with Stanford University, IIT Delhi, and All India Institute. Now this is the Stanford India Biodesign we've been running for the last 8 years, and now we're rechristening it as the School of International Biodesign. And this is a collaborative with our philosophy now being frugal innovation for global health technology, global, affordable, need-based development in healthcare innovation. So that is what our philosophy is, and it has the goal is to become an epicenter for frugal medical technology innovation using the biodesign process and with the focus on developing countries like ourselves. We have the following partners. We have Stanford University, we have QUT Australia, who have a huge big animal lab, because that was one of the constraints that we faced in India. We were not able to do large animal studies in India, and we finalized an agreement with the facility there, and we have all our animal work to be done there. High-end electronic work, again, we had a lot of problems, so we said we collaborate with Japan, and Japan, all their nationals and Panasonics and Hitachi have gotten a meeting from the Samsung of Korea. So they are all now going into medical devices. All these companies. So we've signed an agreement with Osaka and Tokyo University, and we are going to develop low-cost electronic devices in collaboration with them. National, we have the IIT Delhi, we have the AIMS IIT Patna and the AIMS IIT Jodhpur, and the HDIC, which is also part of the DBT, and the IISc, which is also part of the DBT program. Our deliverables are basically two. We want to train people, and we want to develop products. No confusion. We have the rapid prototyping lab, where we have benchtop and proof of concept. We have most of the labs of IIT Delhi open for us as part of the project, and we are able to do first-in-man and clinical trials at All India Institute. So we have clinical design, engineering, entrepreneurship, IP, and business development, and these are our innovators who have become now our consulting faculty, who we have trained. And if you look at this slide, They are a mix of designers, engineers, physicians, entrepreneurs. Could be a biomedical engineer, could be a chemical engineer, could be a geneticist when you're talking of diagnostics. And our philosophy of this biodesign process is basically 3 I's. You identify, you invent, and then you implement. And this is the most important step that I talked about, that the needs finding has to be done properly. And this needs finding followed by needs screening and needs filtering. And then you come up with a concept. Then the concept is selected, and this concept can be prototyped. And then you have the regulatory IP work and then the commercialization, the plans of the project. So the needs finding is done by clinical immersion in the various intensive care units, the wards, and the talking to the doctors, to the nurses, to the ward boys, to the sweepers, to the cleaners, to the residents. They come up with a team of 4 people, 2 engineers, 1 biomedical engineer, 1 designer, and 1 doctor. They form a team, and then they stay together for 2 years. During these 2 years, they go to different parts of the hospital, spend about 3 months just need finding and noting down unmet clinical needs, come up with about 500 sort of unmet clinical needs. A better way to do this. The physician says, I feel that if this faucet was bent 90 degrees more, I had it in my head for so many days, but I've never talked to anyone. If it can be bent 90 degrees more, it will solve my problem for this surgery. So they come up with these, they jot them all down, and this could also be done in the primary health center and in the villages. And then there they come up with needs there as well. They talk to patients there, they talk to doctors there, and come up with these unmet clinical needs. And these needs could be, say, about 500 per batch. And then they screen those needs, impact on the market, what is feasible. They are spent 3 months in finding those needs and about another 6 weeks in filtering those needs by interacting with the physician or the person who has given that need. They're constantly, the center is housed inside the All India Institute, so they're constantly mentored by the faculty. They can go to and talk to them at any point in time that, well, I made this little diagram of that idea that you said. What do you think about it? No, this is useless, throw it away. So it's nipped there itself, rather than they develop it to a prototype level and then the physician says, no, it's not useful. So it's a constant interaction at every level, every day, wherein they develop these things. Now, we started the I Fellowship, or the Indigenous International Innovation Fellowship.
Ask them to sit.
Visiting? Yeah, make him lie down. Lift his feet up. Lift his feet up. I think it's slightly more. Just lift his feet up. He'll be fine.
Shoes loose.